After joint replacement, you'll need pain medication to help with the pain from surgery. As a physiotherapist, I see how important pain management is to how well you'll recover. Patients who told us they struggled with pain management after surgery said they didn't know how to get the answers to their questions. This video was designed to answer some of the most common questions patients have about pain management.
Hi, I am Dr. Martin van der Wyver, and I am an anesthesiologist on the acute pain service. You'll remember that before surgery, a member of the anesthesia team met with you to talk about the type of anesthetic you would have during surgery. We also play an important role in terms of pain management while you are here in the hospital. The goal of your healthcare team is to make sure you're as comfortable as possible. Good pain control allows you to do your exercises and move around better, which is critical to your recovery. The acute pain service will also help to determine what pain medication will work best for you when you leave the hospital.
Hi, my name is Shirley Muskell and I'm a nurse practitioner on the acute pain service. As a nurse practitioner, I have advanced training and I specialize in pain management. A member of our acute pain service will usually come to your hospital room on the first and second day after surgery and ask you questions about your pain. This is so we can help determine what would be best for you. We will ask you to rate your pain using a pain rating scale from 0 to 10. The number that you choose on the pain rating scale and how you describe the pain will help us to determine if the pain medication is working or if it needs to be changed. Your nurse will also regularly ask you about your pain, and we encourage you to let any member of the healthcare team know if your pain is not well managed. Every patient is different in how much pain medication you may need and how long after surgery you may need it. Your pain medication will work best if taken at least 30 minutes before activities or exercises. Pain is often more noticeable in the evening and should be well managed to allow you to sleep.
When you leave the hospital, you will be given a prescription for pain medications from your surgeon. The surgeon will likely prescribe several medications. These may include an opioid pain medication, such as hydromorphone or oxycodone, acetaminophen, which is commonly known as Tylenol, and an anti-inflammatory. These medications work together and can help you more comfortable and able to do your exercises. If you notice that your opioid pain medication is running low and you feel you still need it, please plan ahead and phone your surgeon's office 3 to 4 days before you run out. If you already had your first follow-up visit with your surgeon, then call your family doctor.
These medications, especially the opioids, can have adverse effects or undesired effects. Many people taking opioid pain medication experience constipation. If you're having difficulty with your bowel movements, you should drink more fluids, eat foods high in fiber, and slowly increase your activity. In order to help you with this, you may receive a laxative while you're in hospital, and if you continue to experience constipation while you're at home, you may need to continue with a laxative. Speak with your pharmacist or family doctor about what would be best for you. Another possible side effect or adverse effect of this medication is stomach upset. If your stomach is upset, try taking the medication with food. If this does not help, ask your pharmacist or family doctor to recommend something to settle your stomach, or try taking a smaller amount of pain medication. For example, take 1 tablet instead of 2. If these suggestions don't help with your stomach upset, please call your surgeon. Your pain medication may need to be changed. If the pain medication makes you very sleepy, confused, or quite dizzy, stop taking the medication and call your surgeon for further advice. If your medication makes you a little sleepy or a little dizzy and your pain is manageable, you can try taking a smaller dose, for example, 1 pill instead of 2.
We hear a lot of concerns from patients about the risk of addiction when taking opioid pain medications. This risk is low. However, it is important to wean off the opioid pain medication when you no longer need it to allow you to do your exercises or move around the home easily. If you find it difficult for reasons other than pain, such as the effect on your mood or sleep, to wean off your medications, please contact your surgeon if before your first follow-up visit, or your family doctor if after your follow-up visit with your surgeon. Weaning off this medication is important because if stopped suddenly, you may experience withdrawal symptoms which could feel like the flu, such as fever, stomach upset, sweating, as well as symptoms such as increased pain, feeling tense and anxious. Experiencing withdrawal is not a sign of addiction, but instead means you are stopping the pain medication too suddenly. You will find a recommended plan for weaning off your medication, as well as a tracking sheet in the pamphlet, 10 top questions about pain medication, that you will be given when you leave the hospital.
We have a few other helpful tips that can help to reduce your pain. Each day, it is important to plan to exercise and be active, but include rest periods. Often activities such as standing to cook, sitting in one position for a long time, or walking too long, such as grocery shopping, can increase your swelling and pain. Although walking is a good exercise, it should be increased gradually. The first time you go for a walk, try 5 minutes. If that does not make your pain worse, the next day try 6 minutes and continue to increase it gradually. Applying ice to your leg can help reduce general pain and pain after exercise. It is important though to remove the ice and move it to a different spot after 10 minutes. If it is helpful, you can put it back on your leg after 1 hour. After surgery, it is very important to manage your swelling. The best way to do this is to lie flat and raise your leg with your knee straight above the level of your heart. While in this position, you could apply ice as well as complete your ankle pumping and buttock contractions. Ideally, stay in this position for 20 minutes and repeat 2 to 3 times per day. Your healthcare team wants you to have the best possible experience following surgery. So if you have any questions about pain management, please ask the team. When you're at home, if you have trouble managing your pain or adverse effects from the medication, please review the brochure Top 10 Questions About Pain Medication, provided when you leave the hospital. If your questions are not answered in this information, then call your surgeon's office between Monday and Friday, 8 a.m. to 4 p.m. If it is after hours, weekends, or holidays, please contact the hospital coordinator at 416-967-8551. In summary, pain management is key to good recovery. Don't be afraid to take your medication. Plan ahead and take your medication 30 minutes before exercising. Remember to call your surgeon if you're running out of medication. Check the pamphlet Top 10 Questions About Pain Medication for helpful advice. Then call your surgeon if you still need help. When you're feeling better, remember to slowly wean off your medication. It is helpful to use a tracking sheet. We are grateful to the patients who have given us ideas and feedback to help make a difference for future patients like you.